there, it's Christy with the Chirp YouTube channel. I am in the middle of organizing a talk that I'm going to be giving to a bunch of daycare providers and other types of child care workers. And some of the information that I'm presenting to them I think is going to be likely to be helpful to a lot of my audience on this channel as well. So I'm going to divide those talks into some shorter videos for this channel. And if you are a daycare worker or a child care provider of some kind, even if you just care for your grandchildren, then this series might be helpful to you. The purpose is to help these child care providers to expand the services that they provide a little bit to be slightly more supportive and welcoming to kids who may have different learning styles and who may have developmental diagnoses of some kind. Most people who deal with children are going to run into kids who have different needs, who have a diagnosis of an autism spectrum disorder or Down syndrome or a learning delay or maybe language difficulties. And so some of the topics that I discuss in this series are going to be helpful, and it depends on what kind of children that you have in your program or that you expect to have. But of course, I recommend watching the whole series because you'll get different things from each section, and I think all of them are likely to be helpful to you. This particular segment of the series is going to be about integration and some of the pros and cons that come along with integrating kids with special needs into programming that is filled with kids who are developing typically. So one of the things you'll probably have to get used to is using language that is slightly different from what you might be used to. And in the world of special education, we really like to use what is called person-first language. And so we prefer saying something like a child with autism or a child with special needs versus an autistic child or a special needs child. When we say an autistic child, it just kind of comes across as the autism is the biggest part of that child. And this seemed like a very thin line to me when I was first learning about all of these issues. But as I got to know more and more people with diagnoses, and as I developed some health diagnoses myself, I don't want to be known as my diagnosis first. I want to be known as me first, and then, oh yeah, I also have this diagnosis. And that's how I think that it is the most respectful if we speak about our students. And so listening to me speak about these issues and listening to how I use language in a way that hopefully is respectful towards our students can be a good way to train yourself and to help your staff learn these kind of phrases as well. It's not because we're trying to be politically correct. Yes, we don't want to hurt people's feelings. At the same time, this is more about making sure that our own brains are functioning respectfully towards the students that we will be dealing with. Because if I notice a behavior and I'm blaming the child and I'm angry with the child and I'm defining the child by that one behavior, that one diagnosis, then I am not in a great mindset to come up with a solution, because it's not about the environment in that case, it's not about the supports that I am or am not providing, it's all about that kid. And I don't think that that's very helpful for anyone. Okay, so now that I've said that, integration can have some great positive effects, and at the same time, it can be very challenging. So this video, I'm going to talk about that and about how you can negotiate your way through how much integration do you really want to do, if any at all, and what are your reasons for that. I want you to be well informed before you decide, yes, we'll accept any child, because it's a bigger deal than you might think. Integration in this context means having students of sometimes wildly different needs and abilities in the same program. And the main reason why families see integration as a great thing is because it's really difficult to find childcare for kids who have special needs of any kind. And of course, if the family is working full-time, they need childcare, especially if their child is under school aged. Additionally, many of our families, especially of preschool children, have not yet realized that their child is not developing along typical lines. They haven't explored the different options that are available to them, and they're not ready to accept yet that their child might need more support than a typical child would. And they haven't thought about the fact that that extra support could help their child learn missing skills and therefore not need extra support anymore. And that's something we want to encourage. In addition to those practical reasons why families really want integration, integrating kids with different needs into a typical program can be helpful in additional ways. It gives all students the opportunity to practice and learn that everyone is a little bit different and we can accept those differences. All students also have the opportunity to practice and learn to appreciate the unique skills of each individual person. Students with special needs have peer models to emulate socially, verbally, and behaviorally. That's the big one. We want kids to have the opportunity to learn from people who are more advanced than they are in certain areas. And for our kids with delays, it's extra great to have typical peers around they can learn from. Parents who do have children with special needs usually prefer that their kids be learning alongside typical peers. And one of the reasons is because they don't want their kids to learn bad habits from other kids with special needs, and they don't want them to pick up strange behavior. And in my experience, it's not very common that a child with autism, for example, would look at another child with autism who's flapping his hands and try the same behavior. Most of those behaviors are need-driven. They're not socially driven. So it doesn't make a lot of sense to say, I want my child who flaps all the time to be in a different class from the kid who bites himself, because I don't want my flapping child to learn the biting behavior. The flapping child is flapping because he needs to flap to express a certain sensory feeling that he's having. The biting child is biting because he's having a sensory need that he needs to express and doesn't have a better way to do it. They're not looking at each other and thinking, oh, I want to do that. Oh, I want to do that. That's not a great reason for putting your child in with typical peers instead. But we do want them to learn positive social behaviors, helpful communication behaviors, and great language behaviors from peers. So there is some balance in there. For you as the provider, there are some benefits too. If you are a special needs friendly practice, you'll have a wider group of clients to whom you can advertise. You can say, we do our best to provide support for kids with special needs. You will have the opportunity to learn about areas of child development that may be unfamiliar to you. This is a very steep learning curve, and it does require quite a bit of time and effort on the front end, which is something to keep in mind. But if you are someone who really likes to learn and who honestly really loves kids and all of the miraculous variety of interest that kids bring, then this is probably a topic that's going to be pretty interesting to you. And you'll probably enjoy learning better ways to support the kids in your life. You will be challenged and stretched. Sometimes that's an excellent thing. Sometimes it feels like a little too much. And my favorite is that you'll be learning skills and strategies, and you'll be finding out about tools that are not going to only be helpful to the kids in your programming who have special needs, but to all the kids in your programming. Because visual supports, yes, our kids with special needs need them, but all kids benefit from visual supports. So it's a good thing to implement these things that all kids really benefit from. So sometimes a child's needs are in the area of communication, or perhaps motor skills are delayed. Sometimes a child needs more or less sensory stimulation in a classroom or in a home or out and about in the world. Depending on how much developmental distance there is between a particular child and her typical peers, those needs can be fairly easy to address. Some of these are really not that big of a deal, and the child can, with that appropriate support, really fit in well to a typical program. The more challenging truth to keep in mind is that many of these students also have significant behavior challenges, and these can lead to aggression, and they really do require specialized experience and knowledge to treat them appropriately. And the behavior portion of it is the part that is the most difficult to be ready for. As a child care provider of any kind, a teacher, a church kids volunteer, or a staff person, your first job is to keep your students and your staff safe. Safe. Not getting hurt, not getting bitten, not getting spit on, not getting incredibly discouraged. Safe. It's really important to keep this in mind when you're considering whether to take on a new child, or whether you're considering what to do about a child who's already in your program who's developed concerning behaviors. Yes, we want to fix what's going on with that one child. Yes, we want that one child to be able to be successful in our program. We want to make things work for that kid and her family. However, the other kids in the program and the teachers in that program are a majority of what's happening in your program. If you've got 15 two-year-olds and 2 teachers and this one little kid who's terrorizing things because he just can't regulate himself, that one little kid, while precious and valuable, does not outweigh the other 16 people in that classroom. And that is a hard truth that very few people are willing to state out loud. And I have stated it, and I stand by it. The other people in the classroom are equally important, and there are more of them, and they deserve to be protected if there are dangerous behaviors going on. If your staff is mostly people with very little experience, perhaps they're very young, perhaps they just have no training in child development or behavior management, you're very wise to consider carefully which behaviors you're going to tolerate and for how long before you ask families to find a different placement for their child. No one wants to have those discussions with families. They're very difficult, and they can be very sad for everyone involved. But keeping your students and your staff safe, once again, is your very first priority. Even if you have a very experienced staff, it's kind of a requirement in these kind of situations that you have written policies for how you handle all behavior and how you communicate with families, so that no one is surprised when all of a sudden you come across them and say, we've been struggling with your kid for weeks and he's out. Nobody wants to hear that, and nobody wants to be surprised by all of a sudden hearing that your child's behavior has been an issue. Keep families informed every single step of the way to prevent that all too common shock that families think things were fine, or 2 times in the last month maybe they've said, you know, he hit somebody or something, but 2 times in a month, that's not a reason to get expelled. And I've heard this from a number of families whose kids I've supported. They were completely shocked when the daycare provider mentioned to them that they needed to find a different placement. It's not appropriate if families are surprised. We need to do a better job. We need to have written documentation every day of how every child's behavior was. I kind of like a red, yellow, green stoplight idea, where green is acceptable behavior, yellow is maybe verbalizing threats or having an attitude problem, and red is aggression, hitting, biting, kicking, throwing toys, stamping on toys, ripping books, tipping over tables, that kind of thing. Every red light would mean a phone call home or a meeting with families where you would talk about what the family does when this behavior happens. What do you do when he pushes over chairs at home? A lot of times families say that never happens at home, which may or may not be true, but you can talk to them still. What do you do when similar behaviors happen? We need to know how you're dealing with this. So you talk to them about what they do when that behavior occurs. You find out if there are extenuating circumstances. Maybe the child is on antibiotics for an ear infection and they happen to affect her and she displays aggression when she's on antibiotics and the family has noticed a connection. Maybe dad just lost his job and he's home all the time and it threw off the family dynamic somehow. It's good for you to know what those circumstances are, because if they may lead you to be a little more understanding with the child or offer a slightly softer place to land for her when she arrives in your program. Perhaps you just give her a little more grace, perhaps you give her a little more snuggle, or perhaps she has a little more time to herself. Maybe you take her for a walk by herself with a special teacher. Maybe there are just some ways that you can make that time easier for her. You also use these red light meetings to reiterate what your policies are. Maybe your policy is after 5 red lights in a row, or if there are 10 in 1 month, then we automatically ask every family to please find another placement because we're not equipped to handle certain types of behaviors. If you decide to incorporate more supportive practices in your program, watching a video on YouTube, such as this one, reading any book, even the books that I recommend, none of those things is going to make you an expert on special needs, on autism, on developmental delays and disorders. It's not going to prepare you for the wide range of behaviors that you're likely to see. And it's very unwise to advertise that you're a specialist or that you will accept any child regardless of need or diagnosis. Those things are kind of dangerous because they set you up for problems down the road. To help you with some of the changes that you might need to make in your program or your classroom, I recommend getting a specialist on board with you. Not necessarily a staff person, because they can be expensive, but a consultation perhaps with a special educator. So for example, a speech language pathologist, that's my profession, or perhaps a special education teacher, especially at the preschool level. Those two professions seem to be very good at dealing with the language piece, the classroom structure piece, and also the behavior management portion of this whole wonderful adventure. This person can help you arrange your classroom physically to be more conducive to positive behavior and learning, and can also help share strategies that help you support kids in all stages of learning. As I mentioned, a strategy that's helpful for a child with Down syndrome is likely to be helpful to a child without Down syndrome as well. You can find these professionals by calling your local public school and asking to speak with a special ed department, and possibly then proceeding further and asking there to speak to one of the special ed preschool teachers or a speech language pathologist who works with preschoolers. And once you reach someone, you can say, are you willing to do a little consulting with me, because I have a daycare and I'd really like to make it more friendly towards kids with different needs. And I bet most professionals would say, I would love to help you. I'm glad we can work together on this because we need more people like you. And at this point, I'd like to explain what priority preschool is in the United States, because I would love all preschoolers with any sort of special need or delay to get involved. I know other countries have similar programs, but I have only worked as an SLP in the United States. That's a speech language pathologist, by the way, in the United States. And so this is the programming that I know the best. If a child is 6 or under and is at risk for a diagnosis of a disability, or if a child is older than 6 and has a diagnosis of epilepsy, cognitive disability, cerebral palsy, or autism, that family and child are required by law to receive services free of charge in the areas where the child or person is significantly impacted by the disability. And that significantly impacted part is a big deal because they do testing, developmental testing, and that sort of thing to find out if there are significant delays. And sometimes a child can be diagnosed with epilepsy and not have life impacted that much by it in the areas that they measure. So no one guarantees you free occupational services, free speech language pathology services just because your child gets a stamp on the diagnosis paper. But if your child has significant delays and has one of those diagnoses or is at a risk for delay if under 6, then those services are available. And I'll put a link to the Arizona Division of Developmental Disabilities, and that can give you an idea if you're in another state or if you're in another country, how you might be able to go about finding help for your family in a similar vein. Additionally, if a child is between the ages of 3 and 21 and is found to have a disability that impacts life in certain ways, she is required by law to receive appropriate services free of charge through her public schools. In my state, once again, that's Arizona, the best way to get a child set up to receive these services is to contact the child's public school district. And usually this happens in the preschool age range because that's where families are usually comparing their child to other children and thinking, this is probably not quite as typical as little Susie over there, so maybe I should find somebody to check it out. Usually that's happening in preschool. Of course, we hope it's happening in preschool because that's where we can make the most difference the quickest. And so you'd call up your public school and you would say, I would like a preschool special ed screening. And they will set you up for that, and they're required to do it within a certain amount of time. And if your child doesn't pass the screening, then they do a full evaluation and determine what your child's needs are, where she is falling below the standard, and then they would write an individualized education plan and set you up with free preschool where those needs will be addressed. So any of these government services, if your child qualifies, are free of charge to you. And your child is going to be getting the services that she or he needs. So if you direct families to these programs, it's better for everyone than keeping a child in your program who needs more support than you can provide. Because if you're not equipped to provide the kind of support the child needs, if that's not your specialty and that's not your area of training and expertise, you're not going to be doing it as well, even though you'll be doing it with love, as someone who's been fully trained in that area. And also, it will be free of charge to the family if their child qualifies. And that is a good thing for many families to hear. And so if it comes to the point where you have to say, this child isn't a good fit in our program, we just don't have the skills to work on some of these needs the right way, here are some other options for you so you can get care for your child, so that you can get that extra support, and hopefully your child can progress to the point where she doesn't need it anymore. And at that point we can discuss maybe reintegrating her into our program if that's something that you want at some point in the future. Now that you've heard me talk about this issue for a little while, you can imagine probably what some of the cons are that I'm going to say about integrating kids with special needs into typical programming. It's difficult for teachers to teach at multiple different levels at once. Challenging behaviors require a lot of extra experience, personnel, and time. Kids who need more support confuse your ratios. So if your state says that at 2 years old you have to have 1 adult for every 5 children, but one of them has extreme need for extra support, then that throws off your ratio. You're not going to have the same amount of staff in the room with kids with special needs as you would with typically developing kids. Your staff will need extra specialized training to provide excellent care to kids with different needs, and this is going to cost you time and it's going to cost you money. You'll need to set up specialized areas in your classroom for sensory space, for quiet time. There will be a different classroom setup, and some of that will probably require some different sort of equipment. And you'll need to learn and use new strategies. If you are a learner, if you love to find out the latest research and to keep yourself up to date, this is going to be a really fun thing for you. If you feel overwhelmed with the work that you already have and what you already know, and you kind of just don't want to expand your expertise at all, and you kind of don't want to expand your area of service at the moment, then this would be a good area to kind of rule out as a place you want to be right now. If you're the kind of person who loves to learn and you really like to stay on the cutting edge of how to best help kids, then this is an area you're probably going to really enjoy learning more about. Hopefully this video helps you to think very clearly about how you'd like to approach the issue of integrating kids with special needs into your programming. Upcoming videos will discuss ways to make your programs more supportive for kids with special needs. But keep in mind, once again, that the tools that we use for kids who have special needs are also helpful to all kids, regardless of developmental abilities. And so I think you will find the upcoming videos very useful, very interesting. So stay tuned, subscribe to my channel if you haven't already done that, and I will see you in my next video. Hope you're having a great day. Bye.